In January this year, government of Sierra Leone announced that the Mpox disease was a public health emergency issue after the country recorded 2 cases. Ministry of Health told the national panel discourse held in Freetown on Mpox response session that healthcare workers, government and its development partners made frantic efforts to reduce the disease to a minimum number across the country.
Our focus now is to make sure that we get down to 0. And when you get down to 0, it's not enough. You have to maintain 0 for 42 days before you say the outbreak is over. So now we're looking at getting to 0. Every case matters. We want to know the case. We want to know where they live. We want to know about their neighborhood. We want to bring them in for care and treatment. And at the same time, we want to intensify prevention measures around their home, around their neighborhood, around their contacts, around the community in which they came. Most of the cases I say are in Freetown.
For the Executive Director, National Public Health Agency, Professor Fodesa, numerous action plans and preventive control were underway. They included expansion of test labs, vaccinated over 1,000 people, and intensified community engagement and sensitization. He said they also deployed over 2,000 health workers nationwide. He confirmed 90% of the cases were contracted in the western urban area.
The next steps. We want to ensure that all cases are identified, contacts are line listed, they are vaccinated and monitored for 21 days to detect cases easily for isolation to break the chain of transmission. 2, we want to move all new cases into health facilities for comprehensive care. 3, we detect more cases in communities through active surveillance rather than waiting for them to come to facilities.
Senior Permanent Secretary, Ministry of Health, Andrew Sori, described the gathering as a fulfillment of major responsibilities to Sierra Leoneans in assessing affordable and accessible health care. Arriving at a 0 case according to the cluster lead non-communicable disease, Dr. Thomas Ibo, requires all hands on deck. UNICEF representative said there were sufficient Mpox vaccines available in the country. She called on the government to distribute it nationwide, especially to healthcare workers. Hosted by Umaru Fofana, the national panel discussion had a healthcare provider, Mpox survivor, a journalist, and other health authorities. Each of the panelists emphasized on chain work, disseminating the right information about Mpox, to administering the right treatment, going down to the impact of the media in disseminating the information, to response stage of the victims and those recovering. As of the 14th of August 2025, the country had recorded 84 active cases of Mpox and 51 deaths. Other players spoke on prioritizing community mobilization, establishment of isolation and treatment centers, which resulted to drastic reduction in active cases from 2,000 to 84 cases initially. SABC News, Cynthia Kama reporting.